Diabetes is an epidemic. I ask you to consider the following. Diabetes is now the 7th largest cause of death in our nation. If current trends are not reversed, 1 in 3 children born after 2000 and 1 in 2 African American or Hispanic children are expected to develop type 2 diabetes during their lifetime. 1 in 2. Obesity and diabetes are costing the state billions every year in hospitalization and Medicare costs. And that's not just insulin and syringes, it's knee and hip replacements, it's heart transplants, liver transplants. In fact, one estimate has it that 75% of every healthcare dollar goes to maintenance or treatment of chronic metabolic disease. Type 2 diabetes used to be called adult onset diabetes. In fact, in 1980, there were no reported type 2 diabetes cases amongst adolescents. But now, 30 years later, there were nearly 58,000 in 2010. Doctors are reporting strokes in 8-year-olds, heart attacks in 10-year-olds, and 30-year-olds on dialysis for kidney failure. And yet, type 2 diabetes is a preventable disease. Now, once you have it, that's another story. It's not just about blood sugars being out of whack. It carries with it many commonly occurring complications that combine to lower both quality of life and life expectancy. These include hypoglycemia, hypertension, heightened death rates from cardiovascular disease, higher risk of heart attack and stroke, blindness and eye problems, kidney disease, and amputations. In 2010 alone, about 73,000 non-traumatic lower limb amputations were performed in adults aged 20 years or older with diagnosed diabetes.
In the 10 years of the Iraq-Afghanistan war, 1,500 American soldiers lost their limbs. In that same 10-year period of time in California, 130,000 Californians lost their limbs to diabetes. That's the scale of this epidemic in California. In my clinic, since I'm a primary care doctor, I see patients in clinic. When I started out, about 1 in 6 of my patients had type 2 diabetes. Now 1 in 2 have diabetes. And among the 50% who don't have diabetes, about half of them have pre-diabetes, which is the condition in which you have a high blood sugar, you don't quite have diabetes yet, but you're about to get diabetes. So my clinic has virtually become a diabetes clinic, and I'm not a diabetes doctor.
Today, the overwhelming view of those who study this issue is that the single most significant cause of obesity and diabetes is overconsumption of sugar in any of its many forms. And since 1977, Americans have doubled their intake of sugar. Liquid sugar is a particular problem because of how it is metabolized by the body. And so I'm here to present AB 1357, a bill designed to create a fund and a funding source that will provide a significant source of revenue to educate and provide better nutritional outcomes for young people. Currently, California is falling embarrassingly short. We spend the least on diabetes prevention of any state in the union. There is no state funding for diabetes prevention, and what little funding we do use is provided through grants from the federal government. A comprehensive multi-departmental strategy is needed to combat this epidemic, and AB 1357 creates this strategy. Through funding obtained by a health impact fee on sugar-sweetened beverages, the largest source of sugar in the American diet, the state will be able to distribute funding to programs that seek to fight childhood obesity and diabetes, to improve participation in physical activity, to promote access to healthy fruits and vegetables for our children, and to fund oral health programs. Simply put, the monies collected through the fee will go directly back into the community to address the health impacts of overconsumption of sugar, with a heavy priority given to prevention.
So the latest medical evidence supports this legislation. We used to think that sugary drinks just made you fat. Now we know they also make us sick. These products play a unique causal role in type 2 diabetes and in non-alcoholic fatty liver disease. They have little nutritional value and no fiber to slow transit time through the gut. They thus bombard the pancreas and the liver with heavy doses of added sugar. Blood sugar spikes up and down over time, leading to insulin resistance and eventually diabetes.
You've heard a lot about calories and calories in and calories out, that's what's important. Physical activity is something that we need to be thinking about. Well, of course, those are important issues for all of us in raising our children and in making sure that the children in our communities are healthy. But that is not the driving cause of the epidemic of diabetes in our young people, amongst our young people. The driving cause is too much sugar, not calories. This is a very important discussion for us to be having. It is about public health. Sugar intake is driving this, and it is all about how the body metabolizes sugar. Yes, calories are important. Yes, physical activity is important. But diabetes amongst young people in its epidemic form, what we're seeing that did not exist 30 years ago, is directly linked to sugar consumption beyond those maximums that are recommended by our own governments.